Hello everybody. So this is the answer to the quiz posted on the 18th of September. So the clinical picture is actually pretty classical. This is a 92-year-old male, though the age is slightly an odd presentation to have these kind of lesions at this age. But this is essentially a 90-year-old male with painful ulcers over the left leg since 2 months. The ulcers were well circumscribed with punched out edges covered by necrotic eschar. Now, based on the clinical pictures itself, you can make out that these are vasculitic ulcers. Okay, so this is what vasculitic ulcers present as. Now, this is a low power image. In the first image, what you're able to see is that the epidermis is completely replaced by an eschar crust, which I've shown you higher power images of. Contains basophilic debris and a lot of neutrophils. Now, if you look at the lower dermis, the dermis looks okay, but near the subcutaneous junction, you can see a largish, it's basically an arteriole vessel with surrounding inflammation, and this is located in the septa. There is some septal thickening and fibrosis, with the inflammatory cells spilling into the surrounding lobule. So essentially what you're seeing is a predominantly septal panniculitis. There is no granular layer to comment on hypergranulose or choroidocytosis. This is not calcification. Calcification does not look like necrotic debris and is not present on the epidermal surface. This is basically the eschar that you're seeing clinically, which is basically just a lot of debris, basophilic debris and crust with inflammatory cells. All right. Now, what is the predominant cell type? Here, what you're seeing is just below the eschar. This is the collagen, which appears quite degenerate. And amongst the degenerate collagen are these polymorphs. These are multinucleated cells. Rather than multinucleated, you say multi-lobe cells. And these are all polymorphs and neutrophils. All right. Now, this is the higher power image of the blood vessel located deep down in the dermis. Now, if you're seeing a small vessel located just underneath the ulcer, then you wouldn't call this vasculitis. But here, this is a largish vessel. This is a medium-sized vessel located quite deep in the dermis, near the subcutaneous junction. This is basically inflamed. You can see lots of inflammatory cells within the vessel wall. The vessel wall itself looks a bit degenerate. A bit of fibrinoid necrosis starting to appear here. Okay, and the vessel wall itself looks quite sick and damaged. You can see here it's starting to get necrosed. So this is definite medium vessel vasculitis with surrounding small lymphocytes and a few polymorphs. All right. Now, based on the clinical presentation, this is cutaneous polyarteritis nodosa. Now, if you say that this is just a medium vessel vasculitis and not polyarteritis nodosa, I would agree. There is no contesting that. Polyarteritis nodosa is cutaneous PAN, localized cutaneous PAN, is basically a medium vessel vasculitis. When there is no systemic involvement, we call this cutaneous polyarteritis nodosa. If you want to call this just medium vessel vasculitis and not PAN, there's no particular objection to that. All right. So this is not leukocytoclastic vasculitis. We use the term leukocytoclastic vasculitis when it is just a small vessel vasculitis. Okay. This is a medium vessel vasculitis. It's not a small vessel vasculitis, and because the medium vessel is involved, there is quite severe vascular compromise leading to necrosis of the epidermis. The epidermis is completely necrosed or ulcerated. Now, if it's a small vessel vasculitis, you won't find this amount of necrosis or ulceration on the surface. All right. Thank you very much.